Hi, this is a video talking about neurologic examination. This is a process in the evaluation of the patient that is usually overlooked, but it has components that is imperative for the correct prognosis and diagnosis of the patient. Because the examination is quite lengthy, a lot of physicians just examine the bare minimum, which is a very valid approach. For the purpose of this video, I'm going to explain the cranial nerves and the correct examination of them. The first cranial nerve is the olfactory nerve. A lesion to this nerve will cause an impediment of the sense of smell, which is why for us to examine it, we're going to ask our patient Jimena is going to close her eyes, and I'm going to give her a mild stimulus. In this case, it's this, and she's going to tell me what she smells, what she thinks she smells. What do you smell? Coffee. That is correct. And the next one would be what?
Mint, like toothpaste.
Yeah. The second cranial nerve is the optic one. And for this one, to examine this one, we're going to use a Snellen chart, as we have right here. This is to test the acuity of the visual acuity of the patient. The patient may or may not have glasses. Jimena, do you wear glasses?
Yes.
Do you have your glasses with you?
No.
We're still going to do the test, even if she's not wearing any glasses. So I'm going to point at a letter, and you're going to read the whole row of letters. So we're starting with
E, F, P, T, O, C, L, P, E, D, P, E, C, F, D, E, D, F, C, C, P, F, E, L, O, P, C, D, D, E, F, T, O, T, E, C.
Okay, so she just made one little mistake in the 20/20 vision, but overall she has a pretty good visual acuity. Now we're going to test for the visual fields of our patient. To do this, we're going to stand at approximately 1 meter from your patient. You're going to put your hands on your own peripherals, and you're going to ask your patients to look at me directly at the center of my face, and you're going to detect if my fingers are moving or not. So, am I moving my fingers?
Yes.
Now?
Yes.
Now?
Yes.
Now?
Yes.
Okay, so she demonstrated an adequate capability of detecting the movements of my fingers, so there are no signs of lesions in this nerve. Now, it is also important to notice your patient's eyes. I'm going to touch your face. So we're going to examine the color and the texture of the retina, if there are any exudes, and also the retina vessels should be noted in size, color, in swelling, in all of that stuff. And she appears to have a perfectly normal pair of eyes. So the next nerves that we're going to check are the third, the fourth, and the sixth cranial nerves. These are the oculomotor, trochlear, and abducens nerves. These are also involved in the eye examination because they're the ones in charge to control motor activity of direction gaze, of the positioning of the eyelids, and of pupil size. So the first one we're going to check is the pupil size and how it reacts towards light. So because we don't have the appropriate flashlight, we're going to use the one on your phone. This is actually wrong. We shouldn't do this because the light of the phone is too bright and it could damage the patient's eyes. In order not to do this, I'm going to hold the flashlight as far away as possible, but still eliciting a reaction from her pupils. So you're going to have to look straight at me. I'm going to check if your pupils contract. This one is okay. This one also has a reaction. Now, I'm going to ask you, holding this pencil, I'm going to ask you to have your head fixed. You're not going to move it. You're just going to move your eyes, and you're going to follow this pencil. That's good. What we're checking with this is that there are no abnormalities in the smooth pursuit of the eyes. So if she were to have if she would struggle with pursuing this pencil, then we would assume that there's lesion to these nerves. But because it was a smooth following of the eyes and it was symmetric, they both function properly. There's no there's nothing wrong with the direction of the gaze. And the fifth and seventh nerves are gonna be the ones that are involved in the facial muscles and innervation. So the fifth one would be the trigeminal one, which it branches out into three components, which is the ophthalmic, the maxillary, and the mandibular one. Because it is a sensory examination, we're going to use any probing instrument, and we're going to ask our patient to please close their eyes, and we're going to tell them if you feel the sensation in a very light sensation. So you just brush up.
Yes.
You feel that? You feel this?
Yes.
That's good. And then we're also looking out for temperatures, where we're going to put either our hands. So do you feel any?
Yes, there is a change.
Colder?
It's colder.
Yeah, that's good. And then the seventh nerve is the facial one. And with this one, we're going to test out a bunch of stuff. So if you could come up closer and film him. We're going to ask our patient to please elevate your eyebrows. That's good. If you could frown, that's also good. If you could puff out your cheeks, you're going to resist my pushing. That's good. We're going to ask you also to please blink stronger. That's good. Smile. That's good. If you could wink, that's good. So these nerves, what we're doing is looking at the muscles of the face, because the seventh nerve is related to everything that has to do with facial expressions and stuff like that. We're also going to put our hands on our patient, asking for consent always. We're going to ask them to clench their jaw. If you could do it right now. Unclench. There we go. You could open up. And you're going to resist me trying to close it. That's good. And that's basically everything. The next nerve, the eighth one, is a vestibulocochlear. In this case, we're going to test the patient's ability to hear your fingers rubbing or a whispered voice. And for that, what I'm going to do is going to rub my fingers very closely to your ear, and then I'm going to slowly take it away from you, and you're going to tell me when you stop hearing it, okay? So in this case,
I'm hearing.
okay,
I'm hearing.
okay. So that is a normal procedure. The way that she's hearing the sounds, it's normal for her to stop hearing it at some point. And we also, for this nerve specifically, we would have to use a tuning fork to assess further air versus mastoid bone conduction. But because we don't have that, we're just going to have to go past that. And any problem that we detect with this examination, if there's any complications, we would have to proceed with a formal audiometry. The glossopharyngeal and vagus nerves are the 9th and 10th ones respectively. In this case, we're going to check the symmetry of the palate at rest and the uvula. So I'm going to ask the patients to please open your mouth and tilt your head upwards so that I can see. It looks perfectly fine. Now I'm going to ask for you to protrude your tongue. Take it out. And I'm going to use like this blade to push down and see the uvula. And to test for the gag reflex, I'm going to try to touch the back of the pharyngeal wall. There we go. However, it is completely normal for a patient to not have a gag reflex. In this case, she had one. So the final two nerves are the 11th and the 12th one, the 11th being the spinal accessory cranial nerve. And to check this one, we're going to actually check the shoulders. So we're going to ask our patient to please raise your shoulder as if you were shrugging, and you're going to resist me pushing down. That's good. Relax. And now you're going to resist my hand against your face. So don't move it. That's good. That's okay. So the muscles that we're checking are the trapezoids, which we know is the big triangle right here, and then the sternocleidomastoid muscle. For the 12th cranial nerve, the final one, there's the hypoglossal one. We're going to check the tongue for any atrophy or fasciculations, as well as the position and the strength of the tongue. So can you please open your mouth and take your tongue out? That's good. We see that it's symmetric, there's no abnormal movement. And you're going to push your tongue against your inner cheek. You're going to resist it. That's good. And then the other one. Perfect. And that's how you check the cranial nerves.